Today, it's really a conversation really about what we see in our communications, about cognitive distortion, and what we can do to enhance our communication between colleagues and team members and patients. And the main question that we're going to ask ourselves is, what do you see? That's visually, what is the visual information coming to us? And once we process that information, what does our brain do with that information? How do we perceive the world? And do we all perceive the world in the same way? The answer is no. I don't mean to ruin the surprise, but so what do you see here? Do you know this guy? No, I know him. He's my professor's. He is my residence when I was a medical student. He was my chief resident when I was a junior resident. He is my attendings, and outwardly a hostile appearing person. What do you see? Is this his character? Is this his nature? Really, most people who have an outward appearance of hostility, it's just a manifestation of insecurities and frustration and attempting to get through the world in such a way that we didn't see when we got into medical school, when we were bright-eyed and bushy-tailed and we wanted to, cure the lepers and make the people in wheelchairs walk. And somewhere along the way, we became compromised on some level and we became jaded. And that manifestation often takes into a standoffish, a stonewalling, I'm right, irritability. And really, we're going to sit here and try to discuss how we could communicate with someone to show them the proper respect and really get them on our side. So first of all, how did things come to be this way? Why are people who enter the medical field entered so enthusiastically become so downtrodden? And we're going to look at this. First, we're going to look at the main thing that we all have to deal with is leadership and authority bias. Even the CEOs of companies have a board of directors to answer to. So everyone has their boss. Even the board of directors have the other board of directors. So it's all a big circle of authority. And there are certain models. There's the old model of leadership where the leader knows it all. The leader does it all. The leader is the ultimate. The leader can do no wrong. The leader takes credit for everything that goes right, and anything that goes wrong, well, that's the other people. It's not the leader. Everyone else let the leader down. And really, that's not what medicine is about anymore, nor was it ever about that, but that was the dogma that we were in, that people should be scolded rather than be praised, and the people should listen to the rules and do what others tell them to do with the resources which they have. Now, the new model of leadership, and we are all leaders. Some of us aspire to be leaders. Some of us prefer to work alongside leaders. But even our behaviors as people who want to work with the leaders, we still have to deal with them. And we could actually change the perception of leaders to go into the new model. So you could accept this role as a leader, or you could help your leader understand and find their path into this role. How to be a servant, how to think of other people, how to focus on others, honor them. Honor the people with whom you work. Give them credit where credit is due. It's very important. Help them feel inspired. The world needs more than, people need more than to feel stupid or scolded or they're not good enough. They need to be praised for their efforts to bring out that greatness in them, whatever that greatness is. And we can't take humans and put them into little boxes and put them on shelves, and we have to have everyone give them marching orders. It doesn't work that way. Humanity, just like medicine, it's organic, it's messy, it's complicated, and you know what? That's what makes it so beautiful. So it's not a lack of order, but it's a beautiful disorganization to it, which we could work with it. And we always have to ask yourself certain questions. And the ask yourself is really metacognition. It's about thinking about thinking. How do I think? Why do I think this way? Does everyone think this way? So today we're going to discuss the human condition and non-physical anatomy and physiology, as I like to call it. So the anatomy we're all born with is psychosocial, psychospiritual, psycho-emotional, and the physiology is empathy. And the physiology, empathy is a physiology because someone could work out a lot and get big muscles. Empathy is a skill that we could learn. Even if we have none, we could build it up and we could hypertrophy it. We could make it very dynamic. So that's the physiology. And we're going to focus on the psycho-emotional component because if we go through all four, we'll be here way till the end of the conference. So emotions, what are emotions? You know, the way I see it, emotions, they're the language we had before we had words. This is how we would communicate to each other. This is our feelings we had for each other, feelings of the situation. So when we feel nervous, it's not that it's a flaw in us. It's our primal language saying, hey, something's up here. Pay attention. Every time before I go do a procedure, yeah, I'm scared. I have fear in me, but that fear doesn't drive me. That fear is there's like, hey, you're about to go suture someone. Yeah, make sure you bring the iodine, make sure you irrigate the wound, make sure you have a sterile field. And that's the fear is just to remind me, hey, be responsible for what you're doing. But it's not there to inhibit me. It's just there to remember. The skill of empathy is really seeing things from other people's point of view. Period. It's that simple. You do not even have to agree with them in any way, shape, or form. And emotions are not supposed to be involved, but there are gray zones, and it might be a topic in which we're trying to build empathy for someone else, which might hit a personal accord with us, and we might start feeling our emotions. But remember, emotions, we have no control over emotions. We're not Mr. Spock, right? There's no way we could promise someone, I'll be happy tomorrow, I promise. No, do you promise not to get mad at me if I tell you something? No, that's a completely, you can't promise that. I could promise that, I might get mad. I have no control over my emotions, but I do have control over my voluntary behavior. So I'll tell you if I'm angry, but I'm not going to throw things. I'm not going to yell. I'm not going to do anything outwardly negative. And that's the bottom line is, again, just to emphasize, you do not have to agree with the person. You just have to see it from their point of view. And once we see it from their point of view, we could really start to build a relationship with them. And the first way we do that is listening. We all have the ability to hear things. Few of us actually have the ability to listen to what people are saying. There's a difference. So, first of all, give yourself the advantages of these gifts and recognize that these disadvantages are actually an advantage. We are not perfect. We are all prone to cognitive errors and cognitive distortions. We all have something new to learn. We are very unique. We think differently than other people. And always keep in mind that everyone is the same way. That's the similarity we have, that we all think differently. Tree. Everyone pictures a tree? Okay, great. Great. Everyone has a tree in their mind, right? Okay, good. Okay. All right. Professor Hughes, what's your tree?
Palm tree.
Ma'am, what's your tree?
The oak tree.
Ma'am, what's your tree?
Banyan.
What?
Banyan.
A banyan?
Banyan.
Oh, I got to Google that.
It's a historical tree that just burned down in Lahaina, Maui.
Wow, someone needs to look up their social thing. Tree?
Dogwood.
Dogwood. Something as simple as a tree. Everyone pictures a tree, right? We're all talking about a tree. Yeah, we're all the tree. We're all talking about the same tree, right? What are the chances if we go around this world 3 times that anyone's going to have the same tree in their mind? Even though we all agree we're talking about a tree, palm tree, banyan tree, and even it gets more complicated. Oh, oak tree. Oh, is it big? Okay, fine. Where is it? Is it fall? How are the leaves? Pine tree. Is it in your living room when you were a kid with presents underneath it? Is it in a forest where you went camping with your dad? It's really it's really something we agree that we're talking about, but it has completely different meanings to us. And then we throw in things like concepts of unfairness. That's unfair. That's injustice. Yeah, it's unfair. Yeah, it's injustice. Yeah. Are we talking about the same thing? Are we really on the same page? We don't even have the tree in our mind as the same, and you want to talk about morals and ethics at that point. Completely different. So try to really contemplate this cognitive error, and this is where it starts going into seeing it from other people's point of view. And one of the biggest disadvantages we give ourselves is believing that everyone thinks like we do. If we think that my thought, everyone has the same thought here as me, it puts us all at a disadvantage, especially me, and especially everyone as individuals. I really didn't know how to make this slide because I feel like I'm preaching to the choir. This is not micromanaging. I think a lot of it is just really like, we know this in the health field, but I feel to be in the same story and keep the rhythm going, I think we should just go over it. And this is really about voluntary control, inhibitions, passiveness, and activeness, things that we can do. So first thing, don't focus on yourself. You have your agenda, but focus on the other person. Don't lose focus. Do not complain, unless it comes in a different format. Do not assign blame to someone, and do not villainize people or groups. Yeah, insurance companies, we could blame them, we could villainize them. Does it help matters? Sounds more like complaining at a certain point. Do not assault anyone's character. When I was a director, there was a PA, and everyone had a complaint against her, all the staff. Her name was Allen, Commander Allen. She stood yay tall. She was the commander of a Navy ship. All right, so she controlled a warship, and every morning she had rounds with these 6'4" built guys looking down at her, and she had to command this whole ship. So she learned to speak in a certain way. Now, to me, she was one of the most cuddliest teddy bear people you could ever meet. Everyone else, oh, she's mean. Well, can you do something about her? She's mean. I'm like, no, I can't. I can't unmean someone. What is her behavior that's bothering you? Oh, she yells a lot. Thank you. That's a voluntary behavior we could address. And I went to Commander Allen and said, Commander Allen, you commanded a ship. You're a civilian now. These are not military folks. They think you're yelling at them. She goes, me yelling? I never yell at people. To her, she was speaking in a normal tone of voice that she learned in the military, like, you better make sure that gun is clean, soldier. You got that? Kind of thing. And that was her normal tone of voice. And that's how she gave orders. Strep test in room 5. And she wasn't yelling. She was just having a conversation. So we talked about volume control. We talked about addressing people. We talked about civilian talk versus military talk. And you know what? All of a sudden, she became unmean. She was no longer mean. But that was addressing a voluntary behavior to someone who had very good intentions. I'm so sorry. I don't know about this volume control, so I'm sorry if I blasted anyone's eardrums with that. The last thing, the do not triangulate, do not gossip, do not manipulate. These are social dynamics. Triangulation is when you get a partner to discuss about someone else, to get an ally, to help get leverage. And gossip is involved in that. And manipulation, just don't do it. That's bad. Especially, I'm not saying don't do it because you get caught, but I'm saying if you're branded as a manipulator, your reputation's gone. So just don't engage in it. Let your hard work talk for itself. To do, always take the higher road. Always focus on the patient. Always focus on the goal. Focus on the problem, not the people. That's not me. That's from the Harvard Initiative of negotiations. And it's really something that we could all learn to do. So, for example, with that one of my physicians he was a strict Muslim man, and the medical assistant kept using profanity, making sexual comments, not towards him per se, but just in general. And I said, did you talk to her about this? Oh, yeah, I talked to her. Verbatim, tell me, please. I told her straight up, when you make those comments, I feel very uncomfortable. So all of a sudden, boom, a wall has gone up. You're the problem. You make those comments. You make me feel uncomfortable. That's the way she perceived it. Versus, doctor, how about this? When I hear comments like that, problem is over here, the comments like that, it makes me feel uncomfortable. What are we going to do about those comments? Very different dynamic. Now she's a partner. Now she could check her voluntary behavior versus having her character assaulted. I know it seems like just a few syntax, a few words changed around here and there, but it makes a huge difference in the human psyche. State the problem clearly. What exactly is the problem? And feel free to say the word problem. It's not a dirty word. The problem is, et cetera, et cetera, et cetera. What can go wrong? What went wrong? Well, that's why we debrief. What went wrong? That's why we do the timeouts. What can go wrong? You know, which side are we operating on? Et cetera, et cetera. Leverage all the capabilities of everyone in your organization. And when they come through, praise them. Do not take credit for yourself. Your credit will come from other people. And in regards of complaints, just state it in the form of the problem. You know, when we talk about insurance companies and they do this and they do that and, you know, this and that, yeah, we're complaining, but we're complaining in like facts that we all know, and we're all complaining in the back of our heads, but that's not conducive to the team dynamic because it just turns into a vortex of venting and nothing gets done for the most part. Any questions so far? You know, we don't have to do the Q&A thing. We could have some questions at the end, but please, any questions along the way, any comments, please feel free to interject. This is supposed to be dynamic between us. Let's see. First and lasting impressions. How do others see you? First impressions, when you look at functional MRIs, people, you're smiling. You know what I'm talking about, right? Okay, all right. So first impressions are actually formed in the first 6 to 7 seconds, literally, of meeting someone. And those impressions can be a lifetime. Follow-up studies show that 2 years, if someone has a bad impression of someone, 2 years down the road when they meet them, even though it was just one bad day I was having, and the person knows that that person's a kind soul and, you know, volunteers and, you know, saved a bus full of orphan nuns off a cliff and dived into the water to save a puppy. The functional MRI shows I still have that first impression when he walked in the room and he was nasty. He's a nasty person. That's what my brain is telling me. And it takes years and years and years to go through it. And even though on the top, because we have the conscious level, then we have the non-conscious rather than the unconscious, the non-conscious level, which always keeps track of that first impression. So how do you present yourself? All right. First, you know, we all know how to introduce ourselves, but afterwards the syntax starts. How the question is basically, how do you retrain yourself? And it's just that you have to retrain yourself. Our brains are dynamic. They form new synapses. You know, let old acquaintance be forgot. It literally happens. The brain, you know, breaks off some synaptic connections and it starts connecting to other things. And it takes a long time. Just to change behavior, you're looking at least 6 to 8 weeks to start. And then we're talking, you know, that's kind of routine, and the routine might start becoming habit. And that habit starts becoming part of our personalities, and to the point where eventually it'll run automatic. But give yourself permission to fail. Don't beat yourself up with it. Those of us who were smokers at one point or are smokers, who stopped, if you did, congratulations, by the way. It's the same thing. Give yourself permission. Just, okay, so I started smoking again. It doesn't make me a bad person. It doesn't make me a failure. I'm just going to try it again. And next time, it'll be of longer duration with less cigarettes. And that's fine. The same thing. I was like, oh. I was talking to Professor Hughes the other night. It's like, oh, I could have handled that conversation a lot better. You know, there was should I say the Amazon story? I called Amazon. Okay, like all this talk about, while I was doing these slides about communication, I called Amazon and I was flustered because I got a laptop and I started clicking and it was like no moving parts and it shouldn't be clicking. So it's like a capacitor, something's discharging, something's going to catch on fire. So I call the Amazon and the person answers the phone and I automatically assume they're on the other side of the world. And I ask, well, I had to transfer my data to the new laptop. So I asked the lady, when I do my return, will I get the new product first and then send back the old one, or do I have to send the old one back before I get the new one? Well, you have to go print out a label, and you have 7 days when you print out the label to send it back. That doesn't answer my question. I didn't even want to repeat my question. It was a simple question, you know? And then she starts talking about labels again. I'm like, that does not help the situation. That was not my question. So what you're asking is, do you have to send the old product back before getting the new one? Yes. Thank you. That's all I wanted to know. Click. What did I do? I just insulted someone halfway around the world. I did not have 1 ounce, one shred of empathy. While I was making these slides, not 1 ounce of empathy for that woman sitting on the other side of the planet. It could have been her first day on the job. She could have had a supervisor right there on a headset listening to how she's performing. And I boxed her into a corner because I wanted to know my answer, and I want to know my answer now. Didn't think about that woman. I made someone across the planet feel stupid, probably. And can't answer a simple question. How dumb am I? I should have answered the question. That's what I did to another human being, because I didn't think about it from their point of view. And yes, ma'am.
Recently, I was in a situation communicating with somebody, and they kept saying yes, but. So they were explaining the situation and saying yes, but. And it really was a challenge on the other side. So, any thoughts on yes, but, or have you ever heard of that scenario? Like you're explaining something and you're trying to make it rationalize it. Oh, that was it, but trying to explain maybe why somebody might have had a question or response or something, or explain the story.
I know the yes, but. And when I hear people say yes, but, it's spelled B-U-T-T in my head. You know, the yes, but. I don't like it because it's like you say the word yes and that person thinks, great, they're on board. But, geez, here it comes. What's the but? You know, so it's like someone gets taken to a yes, it's about to happen, but it's not really going to happen. You know, maybe something along the lines of, it seems that you want this and this done. Right? It seems that you're frustrated. I'd like to help you, get this done. However, these are our challenges. Going back to the Amazon lady with that, yes, but I didn't explain myself to her because I could have said, ma'am, here's my situation. I need to get the new laptop to transfer my data before I send the old one back. And she could have said, I don't know, I'm not working for Amazon. You know, she could have said, oh, we can make an exception for you. Let me speak with the manager. Sure, we could do something for you. I did not serve my purposes. I did not achieve my goal. My goal was not a label question, answer my question, yes or no. That's not why I got on the phone. I got on the phone to get a laptop, transfer my data, and send the old one back. And I did myself a disadvantage through my communication, and the process made someone else feel bad. So the yes, but. So are you asking for yourself how you should process it, or
Let's say a person in general.
a person in general? Like dealing with a person that says yes, but a lot? How well do you know that person? If you know them well, I mean, you know, we're all humans, just communicate. Mary, you keep saying yes, but, and when it does that, it really makes me feel, use the I statement. I feel frustrated and confused when you say yes, but, because you're really not attacking Mary's character. You're really observing on a focused behavior. And you're asking, Mary, let's you and I work together to help get this yes, but out of our lives. If you don't know the person, you have to find a different way. And it's really, it's not a cookie cutter thing. You just have to really understand that person. Let's get back to that. Let's go through the slides. Maybe somewhere along the way, a question might come up or an answer might come up. But in the end, with a yes, but is disagree without being disagreeable, confront without being confrontational, and be brutally honest without the brutality. Gentle firmness.
So it's okay to ask somebody, may I share with you? Can I get some input?
Yeah.
At least you're laying the scenario out.
Yeah. But try to avoid the I and focus on the you. Can you help me understand something? You're asking for help rather than using the I form. And gentle firmness. There was a nurse practitioner when I was VP of medicine. She was behind 400 notes, closing notes. She was just diagnosed with cancer. She was symptomatic. She was fatigued from the treatment. And the CEO was yelling at me, you go tell her to close her notes, because if she doesn't close her notes, she's fired. There's a better way to say that, my friend. I don't care how you say it. You just say it. Okay. So long story short, there's ways to communicate with people. I'll be more than happy, to share this with you. But we had a human conversation about the notes, about this chair she sits in, the responsibility of that chair, that not even the chief medical officer could do what she does if he can't close 400 notes. The Surgeon General can't sit in that. Hippocrates cannot sit in that chair because the job has to be done. And if you can't do the job, you can't sit in that chair. So the choices were either close the notes or find somewhere else to work, take some time off, FMLA, PTO. In the meantime, do your notes. Open up the floor. Do you have any suggestions how to proceed? Oh, I love working here. I love working here. I love the team. I love the team. It's like, I cannot. It was Friday evening after the provider meeting. I'm not going to take a yes or a no or your answer now. You need the weekend to think about this. And when you come back on Monday, please think about it. What do you want to do? And it's okay. The conversation was a little more involved. It took a little longer, but that was the gist of it. And she eventually went to another practice, and we kept in contact. I was talking. I was like, "Yeah, I'm gonna leave this company." And she goes right away. She goes, "We're opening up a new office. They need a PCP. Do you want it? I know the owner. You got the job." So here's a person with cancer and fatigue who I basically had a conversation with. If those notes are unclosed, you're not going to have employment here. And the first thing she did was offer me a job. When I said I'm leaving the company, she wanted me to work with her. That's the power of the gentle firmness. That's the power of good communication. That's the importance of treating people with respect. How many leaders do you know who would get a job offer from someone they led at one point? Just think about it. Back doors. These are very powerful. Seems like, sounds like, feels like, because you're not making a general statement. Because when someone says, "Sir, I know you're frustrated," it's like, don't tell me I'm frustrated. I'm not. Who says I'm frustrated? Obviously, I'm frustrated. I just don't want to admit it. But if someone says, "It seems like you're frustrated," I'm not frustrated. Who said I'm frustrated? No. I didn't say you were. I'm sorry about that. I meant, it just seems like. Why don't you tell me what's going on so I could help? It gives you that back door to say, I didn't say it was. It just seemed that way. Why don't you clarify the situation for me so we could have the conversation? And these are the three main things. If you just do that in your interactions, when it comes to being people who are stonewallish, when you encounter a physician who only wants to do one treatment. No, this is the therapy. This is the therapy. Only talks the therapy, this therapy, this therapy, this therapy. Oh, sounds like there's no alternative for the patient, doctor. Then the ego kicks in. Then they want to show how smart they are. Well, it's not the only therapy. There's this and this and this and this and this. And wow, there's so many options. That's great. I'll talk to the patient about these options and see what works best for them. Thank you so much for the suggestion, doctor. You are so brilliant. And they gave you the answer, and they're like, well, yeah, I am brilliant. So there's a lot of egos. And again, it goes back to where we are. I'm telling the story from a physician point of view. It's my perspective. This story could be told from anyone else's perspective, and the story could be completely different. And all the stories are great, and all the stories are equally valid. I'm just talking from my point of view. Because I like it when I am able to show off my smartness and have the courage to make calculated false statements. Yeah. Even if you know the answer, because you can't go up to someone and like, I Googled this. What do you think of this? It's like, I'm the doctor here. That's not Google. I'm not Dr. Google. But make the false statements. It seems like, it seems like there's no other alternatives for the patient. And there are alternatives, but make that false statement. Make yourself look like you don't know. And have the courage to do that, because it's okay to be wrong. So self-identity, how do you see yourself? That's also important. When we wake up, who's that person in the mirror? How do we view ourselves? What's our own self-identity? How do people see us, and how do we see ourselves are completely two different things. And how do we want to be seen by the world? Being here at the summit, I could tell you one thing. Everyone here is an outstanding, stellar professional, and everyone has their own unique and valuable insights. And it's really a privilege to be part of this group. You are a person. You have feelings, dreams, hopes, aspirations, just like every other person. And those things should be respected by ourselves and by others. And just always keep in mind that everyone is striving for that goal and that happiness. And it's okay to be vulnerable. And once you allow yourself to be vulnerable, you can start being honest with yourself. Really, who am I? What am I pursuing? You engage in the metacognition. Why do I think the way I think? And be genuine. And the genuine is a tricky thing, because even people who are superficial or fake, they're genuine. That's their genuine way of being. So, this goes back to a time of discussion between Plato and Socrates, is can someone be disingenuous? And I forgot which one's which, but one of the arguments was like, no, everyone is always completely genuine regardless of what they do. Well, what if they always lie? They're a genuine liar. They genuinely lie all the time, but they're being genuine and they're lying. I'm not saying it's a right thing or wrong thing, but that's just the way they are. Which reminds me of a proverb in Romania. And there was a frog sitting at the side of a river, and a scorpion comes along. And the scorpion says, "Frog, would you please take me to the other side of the river?" And the frog says, "No, I will not, because you will sting me and I will die." And the scorpion says, "Why would I do that? Because I would die too." The frog says, "You make a very good point." And hop on, scorpion, and it takes the scorpion across the river. Halfway across the river, the scorpion stings the frog. And as the frog is sinking into the river, last dying words is, "Why did you do it?" And the scorpion says, "Because it's in my nature." The scorpion's very genuine, so always keep that in mind. And really define what your genuinity is. I don't know if that's a word. We should put it in the dictionary. And also, at the end of the day, just be human. And remember, everyone else around us is human. The person on the phone in Amazon, a different country, they're humans. The medical assistant's a human. The person who has to clean up the blood off the floor is human. Everyone is human. We're all just trying to get by in life. And let's respect ourselves and respect each other, because once we respect other people, that's also a form of respect for ourselves. So thank you very much in most of the languages I could find. Thank you, everyone. You're all beautiful. Thank you so much.